Welcome to today's chat on your mental health during the COVID-19 pandemic. This, of course, is part of the WBFO Mental Health Initiative with support from the Patrick P. Lee Foundation. I'm WBFO News Director Dave Debo, and today we're talking about addiction and suicide. Karl Shallowhorn is here. He's a credentialed alcoholism and substance abuse counselor. He's chair of the Erie County Anti-Stigma Coalition, a mental health educator, and the president and founder of Shallowhorn Consulting, LLC. Karl, thanks for joining us. It's going to be fun today, I promise. I wanted to start by looking at some of your experience. And when I gave that intro, it says, yeah, he has these credentials. But when I talk about experience with you, I think I mean something different. Can you talk about your battles with addiction and mental health and even suicide?
Sure, Dave. So my experience basically with addiction itself goes back to basically as a teenager, late in my teens, I started drinking, went away to college and began using drugs, right away. And within the middle of my second semester, I had a major psychotic episode, which resulted in me coming home, being hospitalized. And for what it's worth, I spent the next 7 years going in and out of hospitals in Buffalo and battling addiction, like I said, going through treatment. And in that time, actually during that first episode and two subsequent times thereafter, I did attempt suicide. I was in a very difficult, dark place. And fortunately, I did get help along the way. And I got, I got clean through a 12-step program. And I've been able to, use those tools I've learned. That was the thing that kind of propelled me into becoming a counselor in the first place, was the fact that I realized that, first of all, recovery is possible. I like the idea of being with other people and being in a recovery environment. So I just wanted to help others like I've been helped.
And were you unique? The idea of some substance abuse problems and some mental health issues, how often do they come together?
Well, statistics pretty much say that about nearly 40% of people who have an addiction problem have a co-occurring mental health disorder. And that says something about the nature of mental illness and addiction, that they really do go hand in hand. I think the number is closer to 20 to 25% of those who have mental illness have a co-occurring addiction disorder. So really, in some ways, which came first, the chicken or the egg? I think when it comes to those conditions, oftentimes one will result in the other. So for instance, a person might have a problem with depression. They might then end up using a substance to deal with that. Or they might have, say, a substance use disorder, and they might then result having a condition like depression or anxiety, so forth, that is a result of them having that condition because they aren't able to perform or do the things that they typically would.
Is it a common mistake then for people to treat just one of them?
I wouldn't say it's a mistake. Years ago, and even up till now, recently, people have been treated in separate systems. So even in New York State, currently we have two systems of care through the government, which is basically Office of Mental Health and the Office of Alcohol and Substance Use Services. So through those two divisions, basically, this is how the credentialing and the regulation is done. We know for individuals who might have a mental health problem, they were typically treated in the mental health system. For those who have an addiction problem, they'd be treated in the addiction system, including within agencies. But now we've been moving more towards an integrated care model where individuals are treated essentially under the same roof, so to speak, with the same therapist who has a training and knowledge and education to help a person with both of those problems at the same time. And the idea why that's so effective is that instead of having a person have to go between, say, two providers to get help, they're actually meeting with one person. Now, mind you, with that provider, there's typically, especially in providers that may be local agencies, for instance, there's treatment teams that work together. There's supervision. So there's all these things in place that will help that individual through that integrated model to hopefully work on their recovery and get to where they really need to be.
Is that a recent thing? Going back to your experience, were they treating you for one and or the other? At what point in the world of treatment did they say, hey, we really have to look at this co-occurrence thing?
Well, so initially, when I had my illness, it started actually in 1981. So that was quite a while ago. And at that time, it really was, in many ways, still treated separately. When I eventually got into treatment myself, more evolved, and then certainly when I got to a place where I was not using anymore, then it slowly began to evolve into what we know now as integrated care, integrated treatment. Certainly over the last, I say, 15 years, it's really ramped up, and it's become more common to have this integrated model in place. But as I said before, the idea is that having a person to receive integrated care is really helpful, because when you're working with one clinician who knows all of your things you're dealing with, as well as has the tools to help you, it really helps to kind of eliminate sometimes some of the confusion, and helps that person really focus in on what the issues are. And remember too, when it comes to something like addiction, there's usually a root cause. So it isn't just the fact that a person just wants to use drugs and alcohol. There's usually something behind that. It could be trauma, it could be other types of, we call them risk factors involved, but usually there's a reason why that person has an addiction problem to begin with.
Well, let's say someone already has a substance abuse issue, and then on top of that, they have either chicken or egg, a mental health issue. Now, for the sake of discussion, let's add in a third one on top of it, COVID-19. What's that look like?
Now, that's something where I think many times providers now have had to adjust virtually overnight when it comes to addressing something like COVID-19 and behavioral health care. And I just use the term behavioral health to mean substance use and mental health care. So behavioral health providers have had to develop ways to address their issues that they've had with their clients or patients in a way they've never had to before. And there are a lot of characteristics associated with the pandemic that have affected people in terms of stress. So when we know that when people are under stress, they tend to be more vulnerable to things like addiction or mental health concerns. So when a person's under more stress, they might act out, they might behave in a way that they normally wouldn't do. So one thing we're finding is that even though a person may not have had a problem with a substance before or a mental illness before, these things are happening for folks now that never had these issues. So one thing that we're learning is that with this new shift that we're experiencing, many people are going through these things, and our providers are having to kind of find new ways to treat people that weren't in place before, but certainly now more than ever, things like telehealth.
The thing I think of is, and maybe this is a matter of degrees. I'm not saying that everyone who has stress from COVID now has a substance abuse problem, but I know that at the end of the night, I've probably been drinking more in a typical week than I used to. I would think that with all the stress that people are under right now, maybe they're turning to that glass of wine in the evening more often than they used to. It's kind of a coping mechanism.
Mm-hmm. Yeah. So yeah, certainly. And we talk about a coping mechanism as opposed to a coping strategy or coping skill. We know that people turn to things like a substance or even a behavior when they're under stress. That's almost like a natural reaction to being under this kind of pressure. If a person doesn't have the proper tools to cope with these kind of things. So if a person's dealing with these extra pressures of being at home, being isolated, being out of work, having difficulty with the relationships, being kind of confined, maybe with children or whatever, that stress level increases. So then thereby they feel that the one way to ameliorate that is to have a drink, maybe have two drinks, or other things they might do to deal with that stress that perhaps they didn't do to at that level before. But because we're under these conditions, we're just finding it more and more and more. And certainly that's where the issues rise.
And I imagine it's probably okay for me to maybe have that extra drink. But if I have a pre-existing problem, that's where it all becomes the slippery slope.
Right. And so we know for individuals that already have a pre-existing addiction problem, COVID certainly in many ways doesn't help. Unless, of course, you are in a recovery program already or you're in treatment already and you're putting those tools in place to manage your condition. But if you don't have those tools, like, for instance, we know that, only 4 out of 10 people, prior to COVID with a mental health concern was getting help. So that means 6 out of 10 people aren't getting help before COVID. Now, I don't know what those exact numbers are. We won't know certainly until after this thing is over or whenever that might be, if you want to call it that.
Yeah.
But the point I'm making is that there are people now who are dealing with these things that are experiencing like never before. So really, when you think about it, it's just difficult for folks to know how to handle it if they are in these situations they've never been in before.
4 out of 10 seek it out, 6 out of 10 don't. Is that
prior to COVID, that was a general statistic we had, for those with mental health treatment in general. And like I said, that number is a reported number. So there are, of course, people that number might not be reported. So in other words, that's a statistical number that's been put out by, say, SAMHSA, which is Substance Use Mental Health Services Administration, which is a governmental agency.
Federal, right.
But for instance, when you talk about drugs, alcohol, and so forth, there are individuals that aren't getting the help that need it. And that's the problem we now have with COVID, is that if you had a pre-existing condition going into this, then your chances of having that problem worsen are going to increase. For instance, we know that even in Erie County, since the pandemic has begun and we had to have these stay-at-home rules, opioid overdoses have increased. We've had increasing deaths from opioids. So because people aren't getting the help they need, or just because of the stressors and things I talked about before, a lot of these things are happening and folks are really struggling.
I've heard people even say it's a tsunami. When this is over, we're gonna have some troubles out there.
Yeah, and of course, I use that term. Other people use that term, tsunami, because when you think about it, if you have all these people that are going through this right now, and this isn't just people who aren't working. We're talking about individuals who might be on the front lines, healthcare workers, people that are basically in essential jobs, people that are working our stores, grocery stores, letter carriers, you name it. People that are out there who've been working all through this time that have to deal with the day after day after day stress of being potentially exposed. That creates stress. So with that comes the increased risk of succumbing to a problem like addiction or even a mental health concern as a result of that.
Karl Shallowhorn is with us. He's from Shallowhorn Associates. Did I get that right? It's a new firm.
Shallowhorn Consulting, yep.
He's a local substance abuse counselor, the chair of the Anti-Stigma Coalition here in Erie County. Karl and I, by the way, go way back. We worked in college radio together. He decided to get an honorable profession. I ended up here. But if there are folks out there that want to join the conversation, obviously this is a topic. We mentioned stigma. We know it's an area where it might not be an easy thing for you to type a comment in Facebook and say, here's my name, here's my thought. But if you're comfortable doing that, please, by all means, we're doing this program to try and get some back and forth, to try and get some comments from you. If you have one on Facebook that you can leave here, we'll get to it as the program unfolds. We're doing this program, obviously, with you on a webcam and me on a webcam. Let's talk a little bit about how telehealth fits into the picture. If I can't go visit my counselor, I can connect to them the same way you and I are.
Certainly, and that's something that was actually in place even before COVID, telehealth, in many ways. I just think of the fact that we are now in a situation where people are being forced to stay at home. Well, I take that back. Not being forced, but strongly recommended.
Right.
I'll change my language there. Strongly recommended to stay at home, but also the fact that to be able to still provide the level of service for individuals that was there previously, providers have had to pivot. Now, people using that term now, they've had to pivot to this newer technology to do that. I'll give you a little anecdote. So I've been in therapy myself since my first episode in 1981, in some form or fashion. Before COVID, basically about 5 or 6 weeks before we really got into this, I reinitiated therapy with a new therapist. And then because of COVID, we had to, stop. We decided not to go further, but then eventually I wanted to re-engage. So last Wednesday, I had my first telehealth visit with her, telehealth session.
Was that your first ever? Was that your first ever telehealth, or had you used it prior?
Yeah, it was through telehealth, my very first time. It was using a platform called DoxyMe, and it is a professional, secure, safe form of therapy that's done through, like I said, through a two-way communication with the therapist. It's secure, And what happens is basically it's like this. The therapist is talking to you. You're talking to the therapist. You're communicating. You can see hand movements and so forth. So basically, it's a way of establishing a way to connect with the therapist in a way that perhaps, say, you can't get into your clinic or to see your provider. That's a new way to do that. And frankly, Dave, I think what we're going to see is going to the future is that telehealth is going to actually even be more utilized because of the fact we have things like people in rural communities.
Sure.
Or actually, I remember even before COVID, they were talking about using telehealth for college students that maybe didn't want to go to the counseling center, but they still want help. They want to be seen going into the counseling center. So this idea of telehealth isn't anything new. It's just that because of COVID, they're using it more.
The VA medical system's been starting to use it for about 2 or 3 years for the same reason, because there's the rural population, the veteran out in Warsaw, New York, that can't necessarily drive into Bailey Avenue, that kind of thing.
Right.
And that kind of contact that they need through telemedicine is something I picture being real important. I want to share a bit of an anecdote. I know someone who was once in town in a hospital room with a relative of theirs that was having a really tough time. And in the middle of that incident, this person looks at her watch and says something to the effect of, "I've got to go now. I've got a meeting." And they left the room and went to an AA meeting. They were in from out of town, but they went through the effort of finding a meeting locally here in Buffalo. They went through the effort of leaving a hospital bed to go to that meeting and didn't break the appointment because it was important to them. I thought that was telling on several levels. One, that none of us knew this person was involved in meetings, had an issue. And two, that they felt the meeting was so important that they didn't want to miss it and actually left a relative's bedside to go to that meeting. To me, that was just a real eureka moment, that the meetings are so incredibly important for someone in recovery. Talk about that.
Well, for people in recovery, meetings are a lifeline. That's the one way I can put it. I mean, for someone, and it isn't just about the fact that it's about not using a substance or engaging in behavior. It's the community. It's the idea of being connected. And for individuals in a 12-step program of one kind or a recovery program for that matter, it might be even a mental health support group. The idea of being collected together with people who can understand your experience is invaluable. And so one of the things I hear is that the therapeutic value of one addict helping another is without parallel. So in other words, one addict can help and understand another addict like no one else can. So in these settings where, for instance, now things are being done online, virtually overnight, once again, just like telehealth in many ways, there were forums for people online for 12-step and type programs before, but now it's everywhere you look. I mean, there's meetings that are all over the world that a person can connect to in Buffalo.
And that's not the split screen that you and I are doing. That's like the thing in the office with 15 coworkers. That's the Brady Bunch screen, right?
Yeah, it's like a Zoom. Most of them use Zoom. They're password protected, so they do follow the safeguards. And by doing that, an individual can attend this meeting, and if they feel like they want to share something, if they feel they need to talk to someone, they can do that, or they could just sit and listen. And then many times that's what people will do. They'll just listen, and sometimes that's enough to kind of get you through that day or get you through that moment that you feel like you might need some help.
So it works.
It absolutely works.
Is it a complete substitute for the regular way, or is it just what we have to do because here we are in COVID?
I don't know if I would say it's a complete substitute or if it's the way that we have to do things now. I just think it's an alternative. I would rather put it that way. Certainly, I think if you ask most people who are engaged in a 12-step program of one kind or another, or any kind of support group that's operating now in an online format, what they prefer, of course, they'd want it in person. However, if you ask those same people that are doing those things, they'll say, thank you that we have this. So in the same respect, I think it's a good thing we're doing right now for folks that might need those supports. Certainly when the opportunity presents itself for people to gather back again in person, I'm sure people will really be happy for that.
Talk a little bit about access, though. Not everyone has high-speed internet now.
Right. And that's another thing too. So access is a big one. We know that not all individuals have access to Wi-Fi. If you have, say, a phone with limited data, that's going to be a concern. That's actually something too that people have dealt with telehealth. You might be seeing your provider, but you may have limited minutes to see your provider with. So that's one thing. Another concern is that for some folks, actually, there's been an ability to come into a clinic or provider where they've set up in a different room the ability to have that computer session with the therapist, so they're not in the same space, but that person's still getting the help. So there are ways that providers have been able to be creative with this kind of work. And then also another thing that's kind of interesting is that just like with the 12-step meetings, providers are doing groups through online platforms. So even group therapy is happening now. So that's really a good thing, I think.
One of the first places I saw it on Erie.gov, they had a list of resources during COVID, and there they had a couple of AA group meetings that were being done online. This was at the very beginning of all this, and I said, "Oh, I didn't even know they were doing them online." Mm-hmm. What are some other resources out there? How do people who are with us today get the information about providers, maybe even get over that hill of stigma to get into the process now, especially during the difficulties of COVID?
I'll give you two good resources. One is, of course, as you mentioned, I'm the chair of the Erie County Anti-Stigma Coalition. And on our webpage at letstalkstigma.org, we have a resources page where a person can go and they can access information on local providers and all kinds of information where they can get information on Erie County and even other Western New York providers. And then there's also the Mental Health Advocates of Western New York, which is a great go-to for information. I worked at the MHA for about 4 years, and they have a great resource online at eriemha.org. Their telephone number is also 886-1242, and anybody can call that number to get help for themselves, for someone that they know. And they have trained personnel there who are able to help you regardless of what your needs are in terms of what you're looking for. They can provide information on providers. They can provide information on support groups. And the great thing about the MHA is that there's no bias. There's no preferred treatment or preferred providers. They will provide information based on what you're looking for. So if you're looking for a specific kind of treatment or you're looking for a geographic kind of concern, they can help you with that too.
All right. I didn't mean to look away there while you were talking, but I'm trying to make sure we get these written down. We will put them in the comment section here on Facebook, so folks who want some of those resources can certainly get them through the comment section. One was eriemha.org. Right. That's the Mental Health Advocates of Western New York. Phone number again, 886-1242, you said, right?
Correct.
Okay. We'll get those up on Facebook so people can follow along there. What is that good for? Let's say I call that number. What happens? Take me through the process.
Essentially what happens is if you call that number, you'll talk to someone in an information referral department. And that individual is basically trained to know where the resources are for where you can get help. And so the great thing about that is that, and I like I said, I worked there for a number of years. I've been in this profession for a while. And one thing I've learned, Dave, is that even though I've been in this world and I kind of take this stuff, I don't want to say I ever take it for granted, but frankly, a lot of people don't know where to go. And I've known that for a long time. I can't tell you how many times I've been approached by people who have get a phone call or even a Facebook message saying, "Hey, Karl, I want to help my brother, my husband, whoever. Where do I go?" And so the MHA can help with that. So anybody can use that number. Go to that website. Also on the website, they have a downloadable PDF. There's also actually a newly updated, regularly updated PDF of COVID-related resources as well. So you can go there and get that information. So it's a great tool to have on hand if you're looking for that kind of help. I mean, the MHA has really been a great resource for people, and I think in many ways it's needed more than ever right now.
And it's not necessarily for the person who's struggling with the substance abuse issue or the mental health issue. It could be the father, sister, brother, uncle, caregiver, whatever.
Absolutely.
All right, very good. Let's talk a little bit too about the different types of addictions. I I'm betting that it's not just a cut and dried one size fits all sort of scenario.
Correct. It's interesting, Dave. I had experience this past semester of being able to teach a class at Damon College. First time ever, as an adjunct at Damon College, I taught a course on addiction. And one of the things that we taught about in the class was behavioral addictions. So, for instance, there's addictions to shopping, there's food addictions, there's gambling, there's sex addictions. There's all kinds of addictions that people oftentimes may not be. People might think they are, but they could be just as damaging in many ways as other addictions, in that the way that they affect the brain. So when a person has as we call a behavioral addiction, essentially it lights up the brain the same way that a substance would when that person's engaging that behavior, because that's the way the brain is made. So we know that if a person has that food addiction, they might see something like a commercial on TV or something that might trigger that craving, we call it. But really what it is, it's an obsession and compulsion. That's really many times what we're talking about with addiction. So
I heard someone just last week. Say that they fear their spouse has a shopping addiction, or else perhaps they're having an affair with Mr. UPS.
Yeah.
Because the packages just keep arriving.
Yeah.
More so now too, obviously during COVID.
Yeah. Well, I think, of course, I think even at my house, we're, more online things. I think that's because out of, I won't say necessity, but, we're just trying not to go to the stores. And of course, we haven't been able to locally retail wise. So that's one reason why. But certainly even before COVID, there were people who were addicted to, QVC, right? Remember QVC? I think it's still around.
Yeah.
The shopping network. I mean, my own mother, God bless her, she died many years ago, but my mother, QVC was one of her favorite channels to watch.
Mm-hmm. I can remember a couple years
ago. And my mother, once again, God bless her soul, but my mother was a clothes horse. My mother bought clothes and just, that was one of the things she was into.
And should we not be able to, well, not buy clothes during COVID, but a related thing, I wonder if society's reaction to all of this is enabling all of this. In other words, lottery is still being sold while there are people out there who might be vulnerable because of gambling addiction. Liquor stores were considered essential right at the start of the pandemic. Talk about, I'm leading the witness, Your Honor, I admit. Talk about maybe the fears that you have about the way the society and business and community is reacting to this in ways that it becomes enablers.
You think about how first of all, we live in a consumer society, right? And in our society, more is better, right? We don't, most people don't live extremely simple lifestyles. The more things you have, the better off you are. At least that's a message we get. And so we become indoctrinated with that kind of sense that if you have more things, you're better off. But then again, if you are, say, vulnerable or susceptible or predisposed to addiction, you can then thereby be caught up in the grips of say a shopping addiction or even a food addiction or gambling or anything like that basically will continue that process, and then eventually things can get out of hand and you can end up losing more than you thought you would in the first place.
And the reason for that is because the shopping, the eating, the what have you excites us at a time when COVID has me kind of blue. I can get a little bit of a jolt in my life by suddenly going on eBay or getting extra cheese on those French fries, that kind of thing. It in our brains, it lights up the reward center.
Right. And now, mind you, like I said, we're talking about for folks with pre-existing addiction problems. I'm not saying that everybody who goes online to Amazon or eBay that buys something has an addiction problem. I'm not saying that. Or I'm not even saying that the person who goes to their liquor store to buy a bottle of wine for dinner has an addiction problem. I'm not saying that. One thing to recognize, Dave, is that when we talk about an addiction disorder, typically it's something that interferes with your daily affairs, it interferes with your way of life. There's some type of consequence, either in work or even school, consequence in terms of your relationships. So there needs to be something to look at in terms of what the effects are of that use. So that's a way of kind of looking at your behavior. The problem is that when a person is dealing with an addiction, they may not see it. They may not realize it. And sometimes it's even what we call denial. It may not even be that. It's just the fact that they don't see it as being a problem. And it might take another person to say to them, Dave, I really think your drinking has become a problem because, you're just not behaving the way that you used to. You're falling behind in your work. You're not getting your news stories done. And we're really concerned about you.
It also, to my mind, goes back to something you said at the top, the whole idea of chicken and egg,
Right.
of co-occurring disorders. Chances are I could be drinking because there is a underlying mental health issue, or there's this sounds like an oversimplification, but there's something in me that's missing that I'm overcompensating for.
Yeah, and I think what happens here is that when we're dealing with that idea of that coexisting condition, sometimes, as I said before, we don't know how to manage it. And I guess one of the simple ways of putting it is, if you're depressed, you might feel like, okay, I need something to pull me out of this depression. And it's so funny. You hear people say all the time, well, I'm not just going to get up and go run, or I'm not just going to get up and go exercise. I don't feel like doing that. But hey, you know what? If I can take a pill, or if I can take a drink, or if I could take a shot, whatever, that helps. And you know what? It helps like that. And see, that's the thing that people are looking for with addiction issues many times to solve it, is that quick fix. And one thing that we need to understand is that if a person's dealing with an addiction problem, it usually isn't a quick fix. It's usually something that has to be treated in a way that requires some work, requires some insight. And insight is basically knowing yourself, knowing that, first of all, that you have a problem, and then knowing what you need to do to address that problem.
And what if things are so deep and dark that I'm not getting that quick fix, that it's just not working anymore? What are the danger signs there? And I guess what I'm really trying to do, is steer the conversation a little bit toward the suicide risk, especially now, again, during COVID.
Well, absolutely. I think, we're seeing now that COVID is, as I said before, is raising the stress level for people through the roof. I don't care who you are, where you live, what your status is, we're all under stress. Some people are more susceptible to stress than others. Some people, like I mentioned before, are working in settings that are more stressful and more sensitive to the diseases than others. So essentially, if you're under all this stress, if you are predisposed to a mental health condition, especially if you're predisposed to, I'm sorry?
Yeah, first, if you could just restate what you're saying, you froze up for a sec.
I'm sorry. If you're predisposed to a mental health problem, if you're predisposed to an addiction problem, then certainly, your propensity towards suicidal thoughts might be higher. You might be thinking of a way to get out because you feel like there's no way out. You feel like there's no recourse. And as I said, when I opened up my opening remarks, having been there myself, I mean, when a person is feeling suicidal, it's a very, very deep, dark place to be. It's almost like being in a hole that you feel you can't get yourself out of. And that's where you find your thought of saying, what, there's only a way to do it. And what we know, though, is that suicide is preventable, first and foremost.
That's interesting to hear you say that.
Yeah. So for instance, if you know someone, and of course, it helps to know what to look for in terms of the signs of suicide. But if you know what to look for and you know what the signs are, then you certainly can talk to a person about that. I teach a program called Mental Health First Aid. And Mental Health First Aid has a 5-step action plan. And the first step is to assess for risk of suicide or harm. And when you do that, when you talk to someone and you're able to kind of learn and you discover that, in fact, that person is at risk, well, first of all, we have to ask that question. Are you thinking of killing yourself? And that can be the hardest question you ever have to ask someone. But if you do ask that question, then you have to know what to do. So if they say yes, you ask them, Do you have a plan? Do you have the means? When do you plan to carry out that plan? And then there are resources like crisis services, the National Suicide Helpline. There's places where you can access locally to get that person help.
I want to get to resources in a second, but the questions that you followed up on really intrigued me. I, as a layperson, wouldn't want to say to someone, gee, do you have a plan? Do you have the means? Because to me, that would seem like it's starting them down a road that I don't want them to go down. You, as a clinician of sorts, as a non-lay person, is saying that that's part of the way to open up the discussion. That to me is really interesting.
Every suicide prevention program out there says the same thing. You must answer that question directly. And research has shown that when you ask that question directly, the vast majority of people respond honestly and will give a response that will enable you to discern if further action is needed. And frankly, I've been in that situation myself. I've had to ask that question myself of people that I know. I had a situation, and I'm not going to go into too many details, but I did ask someone that question, and the person did respond that they did have a plan.
Wow.
So I had to, there's a thing called a safety plan. I kind of helped them identify a safety plan that they could use. And then they went to their therapist, provided the same safety plan that I had, suggested. So, but that's why, knowing how to intervene is a way that we can prevent these things from happening. And mind you, we also know there are times when, people say, well, we didn't see it coming. We didn't see this, this happening. And we know that that can happen. We're not saying that in every instance that all the signs are there that you'll see. However, the vast majority you will. Another thing we know is that, in most cases, suicide is linked to mental health or substance use. So if a person has a mental illness or a substance condition, that risk is higher for suicide.
And the idea of having a safety plan, that ties into, I think, something you said earlier, this concept, this term, mental health first aid. That's part of the process, the intervention, more than just putting a butterfly or a suture on an open gaping wound.
Yeah, certainly. So mental health first aid is a program. It's an 8-hour certification program. It's actually being modified to a virtual format now. It's going to be 6 hours. But essentially, it's a program that teaches about identifying the signs and symptoms of mental illness, as well as addiction. It also talks about raising awareness, reducing stigma. But it's a very practical program that anybody can use and understand mental health. It's about basically knowing what to do when a person is in crisis, how to listen, how to give reassurance information, how to encourage appropriate professional help, how to encourage self-help and other support strategies. There's 5 steps that a person can take to get that person that help that they need and to be that source that person might benefit from if they're in that circumstance of requiring that kind of attention.
And then resources, and we've taught this one just in the reporting that I've done. I know this one by heart. I'm sure you do too. Crisis Services, 716-834-3131. If anyone feels they are in crisis, they should pick up the phone on that one.
Yes, so that's Crisis Service of Erie County. That is Jessica Pirro, a good friend of mine, is the CEO. Their team is amazing. They have been working triple overtime, Dave, during this pandemic to make sure that people are being taken care of. So that's a great resource. But also our folks in Niagara County, there's a Niagara County suicide prevention line, and that number is 716-285-3515. Once again, 285-3515. The National Suicide Prevention Line is 1-800-273-8255, 1-800-273-TALK. And there's also a text line where you can text HELP to 741-741.
Yeah, that's one we talked about last week when we were dealing with first responders and first line people. And again, we'll get these all up in the comment section on the side of the screen. In the remaining little bit, if there are folks that want to join the conversation, you can do that too. Just type something into the comment section and we'll pose the question or the comment to Karl and move the discussion ahead a little bit. In the meantime, though, what are your suggestions for the future? As people begin to get over this fear of getting sick, they're probably I almost think it's not necessarily the second wave of physical symptoms, but maybe a second wave of mental or emotional symptoms. We've adjusted to COVID. We know that there's a certain amount of new normal here. I'm not afraid anymore I'm going to get sick. What's that second wave to your mind?
Well, first and foremost, remember that there's help available if you need it. And like I mentioned before, we're going to be dealing with people with say, post-traumatic stress disorder. So these are the long-term effects of what we're going through right now, especially with children. Children, I believe, are going to be susceptible to these long-term effects that we may see for years to come. So we must be prepared for getting people help that they need, so that if they do experience problems with their mental health or develop addiction issues or whatever, they get the resources. So like I mentioned, the Mental Health Advocates of West New York has information through their agency that can provide people with where they can go to get that help. Another thing too to remember, Dave, is that there's things that are within our control. There's things that are outside of our control. And personally, I know for me, I'm trying to remember what's within my control. So one of the things that's within my control is staying safe. So following things like we've been hearing about, wearing my mask, wash my hands, practicing the distancing, physical distancing, doing those things to keep myself safe. The more of those things I do, the better able I will be to understand that, okay, the stress I feel from that risk of becoming sick will be lessened, which will then help me in my mental health. Because I have less stress, then my mental health will be in better shape. So that's how it ties in.
It's the old serenity prayer.
Yeah.
And I'm trying to remember all the details. The wisdom to know the difference.
Grant me the serenity to accept the things I cannot change, the courage to change the things I can, and the wisdom to know the difference. And the key is the wisdom to know the difference.
Right. Very good. Last question is always the easiest, Karl. And as long as we're talking about serenity and hope, give me some hope here. What does the future look like?
Dave, I always believe that there's silver linings. And even though it's hard to even believe there's a silver lining in all of this, but my belief is that through all this, people will come to a greater awareness of who they are. It's interesting. I had a Facebook correspondence. A friend contacted me last night through Facebook Messenger, and she said she was a little scared. She was anxious, and so one of the things last thing she said though was she said, "I won't take anything more for granted." And that's the thing I want to remember, is that I don't want to take anything for granted. I don't want to take my life for granted. I don't want to take my family's life for granted, but also I don't want to take my health for granted. The fact that I'm able to breathe, do things and enjoy life to the best I can during the circumstances, that's a good thing. And I think just the idea of having hope, like I said before, hope is essential. I think we have to believe that it's going to get better. It's going to get hard, but in the end, we're going to get through this in one way or the other. We're going to have to adjust. But that's just the reality that we're in right now. And if you keep all those things in mind, then we'll be able to get through this.
All right. I think that's probably the perfect place to end. Karl, thanks so much for this.
Thank you, Dave.
Karl Shallowhorn, a credentialed alcoholism and substance abuse counselor, a mental health educator, founder of Shallowhorn Consulting, LLC, and the chairman of the Anti-Stigma Coalition in Erie County. Thanks to Karl for being here. I also have to obviously thank some of the people behind the scenes, Lynn Bader, our producer, social media coordinator, Johnny Moran. Thanks to all of you folks for watching, not just this week, but past weeks. If you haven't seen some of our earlier conversations, there's one on stress, there's one on PTSD, there's one on the elderly and isolation, one on children and education, another one on frontline workers, healthcare workers. All of them are available right here on our Facebook page or at WBFO.org. This series is part of the WBFO Mental Health Initiative with support from the Patrick P. Lee Foundation. I'm WBFO News Director Dave Debo. Have a great day. Thanks for joining us.